My name is Dr. Tom Moore. I'm an infectious disease physician. I've been in town in this community. I'm born and raised here and did my training at the NIH under Dr. Fauci. Been here since 1997. And I was the one that wrote the letter that is on your desk urging action. With regard to the cases we're discussing, the first case presumably acquired it from a cruise ship. He's recovering in Butler County. That's where he's from. The second, he's been dismissed from the hospital, obviously. The second case is still in the hospital. He acquired his case in Oregon and was visiting Dodge City, family members in Dodge City. The other cases that came in subsequent to that, those are cases that were acquired in Sedgwick County.
And that's the one
That's
that
the one at the VA and the one is sheltering at home, and then we have an additional one that was just reported now.
And we don't know where that one is being treated yet or what the situation is. We don't know that one.
I have no information about that patient currently.
And the reason I ask is, again, like Commissioner O'Donnell, I didn't have the privilege of listening into the discussion today with the medical society or the doctors that were discussing this with the city of Wichita and a couple of county commissioners. But one thing I did hear from that discussion was, and hope this isn't secret information, but I was told there was 84 new beds between those two hospitals, 84 new ICU beds that were designed to handle COVID-19 cases. Is that something somebody can confirm or deny?
I don't.
I'm Dr. Chloe Steinshouer. I'm one of the pulmonary and critical care physicians. I'm also the medical director for the ICU at Wesley. The 84 beds that you're referring to are surge planning beds, which means they are modified beds designed to take over if we exceed the capacity that we already have. So these are not new beds in the hospital. These are things like remodifying ORs or our PACU into a modified ICU.
Right. I guess I'm not trying to say that these are beds that didn't exist before, but these are beds that are now dedicated potentially to COVID-19 cases that before now they weren't necessarily. I guess let me ask the question another way. In addition to the 84 beds that are now designated for this type of treatment, are you able to speak to how many other beds there are in Sedgwick County between the two hospitals that are now essentially designed or reasonably okay for this type of treatment?
I can tell you how many beds are in planning for crisis for this. And so if you take all of the ICU beds at Wesley Medical Center, including crisis beds, including PACU, OR, and using the emergency department for that, it's estimated that we can get over about 150.
Does that include your current capacity of 60% already used?
No, that is straight from zero.
Okay.
So that is assuming that we have no other patients except for COVID-19 patients. So that doesn't include any of the patients who will continue to come in with trauma, with acute MI, with sepsis, pneumonia, influenza, and all of the other things that we're already dealing with.
Okay, thank you for the answer.